Cancer remains one of the toughest illnesses to beat. But researchers believe soon we'll have a new wave of treatments. Common viruses could hold the key. In this lab, they're using them to attack and destroy tumours. These viral treatments offer some of the most exciting advances medicine has seen in years. At the Institute of Cancer Research, I've come to see it in action.
This was the only real option for me, and I truly believe it's actually saved my life.
Professor Kevin Harrington is at the forefront of immunotherapy. But what is it, and how does it work?
In the last decade, we've understood that we can make viruses that are able to grow, preferentially in cancer cells, kill them, and in doing so, make the patient's own immune system see the tumour and react against it.
Our bodies are great at finding and fighting infections, but cancers are a blind spot. Our immune systems struggle to see the danger.
So this is a bit of genius. What you're seeing here is melanoma, the sort of cancer that causes skin cancer. And what they're going to do is infect it with a virus, and that does two things. The virus can kill the cancer directly, but also, very importantly, it paints a target on the cancer cells, and it lets your own body's immune system see them and attack them, so there's a double win there, and it's a fantastic opportunity for a cancer therapy.
We're going to actually see this in action with researcher Gabby Baker.
Gabby, tell me about this experiment.
We've got some live cancer cells, which we're going to infect with an oncolytic virus.
An oncolytic, I mean, that literally means a virus that splits the cancer cells up. So you're going to take these cancer cells, give them a virus, and hope it kills them.
Yeah.
All right, well, let's go and see how that works out.
Today, we're using a reovirus, a cause of the common tummy bug. Relatively harmless to humans, but great at painting that target on cancer.
And so what Gabby's doing here, she's going to make a white blood cell, one of your body's immune cells, kind of glow in the dark, so that hopefully we'll get some pictures of it attacking cancer, and you're going to see that under the microscope.
Later, we'll see if it's worked. One advantage is fewer side effects when compared to, say, chemotherapy. Alan Melcher is a professor of immunotherapy.
It's rather a sort of blunderbuss. You're going in there non-specifically, and you're hoping that your chemotherapy is going to damage your cancer cells slightly more than it's going to damage your normal cells. Whereas with things like immunotherapy or virus therapy, if we understand the science and the biology of what is happening, we can be far more targeted and smarter about what may work and what may not.
These kinds of therapies are already being used on previously hard-to-tackle cancers.
One of them is the first viral treatment for cancer approved for use in Europe, and it's called T-VEC.
Kate Cochran was diagnosed 3 years ago with melanoma. The situation looked grave.
Right at the very beginning when I was diagnosed, there weren't a huge amount of options for me, mainly because it was in the lymphatic system. So the chances of it coming back was really high, which kind of ruled out just having normal chemotherapy. So this was pretty much the only kind of real option for me.
After the T-VEC trial, Kate's cancer appears to be gone.
I believe the treatment saved my life.
Back in the lab, our test illustrates how Kate's treatment worked. The immune cells, coloured green, are attacking the cancer cells.
You can see these immune green blobs right in there attacking that mess of red cancer there, and this is what you want.
And here's the process speeded up many times. White blood cells move in and kill the cancer.
For the first time, it feels to me like this is a new frontier which offers the hope of cancer treatments that are more effective with much less harmful side effects.
I think that viruses are going to be a central part of how we treat cancers. Immunotherapy is completely changing the way we look at treating cancer.